This patient came to see me with issues on tooth number 8. He had a previous root canal and a large area of infection. And look at the crown to root ratio, it's 2 to 1. And they really still want to try to save this tooth. We took a limited field of view 3D CBCT. Look how large this lesion is. A lot of bone destruction with this case. This patient had a history of ortho and trauma, and he really wanted to try to save this tooth. I told him this is going to be like a miracle. He said he did not want to have an extraction and implant. And look at all this bony destruction here. Look at this sagittal slice. It's like someone came through with a buzzsaw and literally took the complete root off. And so we decided to do the retreatment. This is our apical gauging with the size 140 headstrom. We used Pro-Root MTA and we packed it into the apex. I got a little bit more out than I wanted to, but we said we're gonna let the body and the bioceramics do its work. We brought this patient back in 6 months. Literally, there's no mobility. Went from a class 2 mobility to a class 1 mobility. Look at this bone starting to fill in. There was a sinus tract. The sinus tract was gone. And this patient is ecstatic that we're able to actually get this tooth this far. Look at this sagittal slice. You can see there's some bone starting to form around the apex of this tooth. And look at this. This is the coronal slice showing healing. Nice healing is starting to take place. This is the before and after on the 1-visit retreatment on a really amazing case. I talk more about this in my textbook. Go check it out.